Assalamu alaikum, welcome back to my channel. So let us continue with the chapter diagnostic procedures, and the topic is case history. The purpose of case history is to discover whether patient has any general or local condition that might alter the normal course of treatment. As with all courses of treatment, a comprehensive medical and previous dental history should be recorded. In addition, a description of patient symptoms in his or her own words should be recorded. Chief complaint. It consists of information which prompted patient to visit a clinician. Phenomenon, symptoms or signs of deviation from normal are indicative of illness. The form of notation should be in patient's own words. Symptoms. Symptoms are defined as signs of departure from the normal. They are indicator of illness. Symptoms can be subjective symptoms and objective symptoms. Subjective symptoms are told by the patient. The most common subjective symptom is pain. Objective symptoms are ascertained by the clinician by different tests. Subjective symptoms. Pain. Once the patient completes information about his or her chief complaint, a report is made which provides more descriptive analysis about this initial information. It should include signs and symptoms, duration, intensity of pain, relieving and exaggerating factors, etc. Examples of type of the questions which may be asked by the clinician in recording the patient's complaint are as below. How long have you had the pain? Do you know which tooth it is? What initiates pain? How would you describe the pain? Quality: dull or sharp or throbbing or constant. Location: whether it is localized, diffused, referred or radiating. Duration: intermittent, lasting for seconds, minutes or hours, or constant. Onset of pain: stimulation required, intermittent or spontaneous. Initiated by cold, heat, palpation or percussion. Relieved by cold, heat or any medications or sleep. In other words, history of present illness should indicate severity and urgency of the problem. If a chief complaint is toothache but symptoms are too vague to establish a diagnosis, then analgesics should be prescribed to help the patient in tolerating the pain until the toothache localizes. A history of pain which persists without exacerbation may indicate problem of non-odontogenic origins. Pulpal pain can be sharp, piercing and lancinating. It is due to stimulation of A delta fibers. Dull, boring, excruciating or throbbing pain occurs if there is stimulation of C fibers. Pulp vitality tests are usually done to reach the most probable diagnosis. If pain is from periodontal ligament, the tooth will be sensitive to percussion, chewing and palpation. Intensity of pain gives an indication that pain is of pulpal origin. Patient is asked to mark the imaginary ruler with grading range from 0 to 10. 0 means no pain and 10 means most painful. Mild to moderate pain can be of pulpal or periodontal origin, but acute pain is commonly a reliable sign that pain is of pulpal origin. Localization of pain also tells origin of pain. Since pulp does not contain proprioceptive fibers, it is difficult for patient to localize the pain until it reaches the periodontal ligament. Thank you for listening. If you found this helpful, don't forget to subscribe. The next topic will be covered in the upcoming video.